so we're going to talk today about how we got where we're at and where we're going and trying to increase awareness about creatine for not only the scientific community, but for general health and well-being as we age. And before I start, we've asked to have disclosures. I don't have any patents on creatine. I don't make any money from creatine. I'm a scientist interested in translating the best science to improve quality of life. And so although I serve as the chair of the Scientific Advisory Board, I don't directly get funding for sales and things like that, although we've obviously have done research and have grants to our institutions over the years. So let's talk about creatine. If you go back, creatine started really in the 1800s. And there was actually some data that animals, changes in creatine content in muscle, and the first product we think on creatine was actually in the 1800s. And it was from Lubin's lab in Germany, and they found that animals, when they exercised, their creatine levels increased, and they found that when they fed people this meat extract, their work performance went up. Maybe this was the first creatine product. And then there were studies in the 1800s on work in tetany and muscle contraction, and the first paper I found was in 1909. We think of creatine as new, but it's been around for a long time. And so there's actually studies here where they report that if they gave dogs creatine, they gained weight, they improved their work performance. And so they even had a few humans in the subject, probably people in the lab, they gave and they found their work capacity also increased. And over the years, if you look at the history of creatine, we think we're doing novel stuff on health. But look here, the first study in diabetes is in 1911. First study in infants, 26. Studies in pregnancy in the 40s and 50s. So a lot of the initial research, we're looking at various aspects of what happens in the body to creatine and creatinine with different type of metabolic stressors and different health conditions. And so then we get to the 1960s, and I think this was where creatine research really took off, when they discovered how to do muscle biopsies in Bergstrom's lab. And you see people that have done creatine research over the years, like Hultman, Bergstrom, Salin, Roger Harris, Tia Wallman, who will be speaking to us later. Really in the 60s and 70s started the understanding of how creatine affects metabolism, creatine kinase, et cetera. And so this really moved the research forward. And then there were studies in the 70s on medical applications in heart patients, and then giving creatine to creatine synthesis deficiency children as they age to try to offset creatine synthesis deficiencies. And then really the paper that really launched the modern era of creatine, even though a lot of studies had been done before that, was in 1992 when Roger Harris and Hultman and Karen Soderlund published their paper in 92. And this really started the interest in creatine as a potential sports supplement. But if you remember back in 1992 Olympics, they had several athletes taking it during the Olympics and won a gold medal in the 100. And then people like Paul Greenhoff and Balsam and Casey and Birch did a number of studies showing that creatine could be affected and really affect muscle contraction and fatigue. And then, of course, the work from Roger Harris was honored with the first International Society of Sport Nutrition Career Achievement Award in 2017. And of course, we miss him, and we just did a tribute about how creatine research has really shaped sport nutrition from the muscle biopsy days from Hultman and Harris to Roger's work. And we have a tribute to him as well. But if you look at over the years, in the 90s, there was an explosion of research. People like Conrad Ernest, our group ourselves, that we started doing creatine in athletes. We think these were the first studies in trained athletes that were done. And then work by Volek and Kramer showing that it wasn't just water weight, it was muscle mass and strength and performance. And then a lot of people that are here today, like Tim Ziegenfuss, who did one of the first studies on muscle contraction with Pete Lemon with MRS spectroscopy. Mark Tarnopolsky, one of the pioneers in medical aspects of creatine. Darren Willoughby showing again it was muscle, wasn't really just water weight. Peter Hespel's group. And so if you look at the history and look at all the different researchers, work from Jeff Stout and Abby Smith-Ryan, who's here as well. All this set the stage for creatine as a potential nutritional supplement for athletes. And then the list goes on and on for many of the people who will be here today of people who have made contributions over the last 10, 15 years more on health aspects and medical uses of creatine. If you look at the explosion of research, this is PubMed research numbers from the early 1900s all the way up to present day. And there was several big key points. When the biopsy came in, there was a peak. And then when Roger Harrison, Haltman, Sutherland's paper came out in 92, another peak. And then when we then started getting position stands, there were increased peak. And then we'll talk about what happened over here in a minute. But you look at it, there's over 10,000 studies on creatine in animals and humans, where creatine's in the title. There are over 4,000 or 7,000 with creatine in human. There are over 700 papers or clinical trials in humans that have been done on creatine over the years. And so there's a very large body of evidence showing that creatine can have an impact on health and performance and is safe. Yet, over the years, after we did a lot of the research that came out in the 90s, all of a sudden we saw something in the USA Today saying creatine linked to deaths of wrestlers in the USA Today. And I remember being interviewed on that, and Bill Kramer and myself was like, no, there's no data showing there's a problem. But this spawned a number of articles on the internet about the lack of safety of creatine. And we now look and put in the computer or internet search creatine side effects, you see all things listed. Like it causes water retention. At the same time, it causes you to dehydrate. Digestive issues, mood disturbances, it makes you build muscle. It's got to be like an anabolic hormone, right? No. And so there's a lot of things that are out there about the problems with creatine and how to resolve the issues that not causing the problems. And there's even been links that creatine causes baldness. Of course, it has to be the creatine. Come on, man. That's garbage. I was going to have a different illustration of an animal, okay? And so we go then on to what happens. Well, we knew this was nonsense because we had done studies in athletes over the years, in football players, in hot, humid Memphis, Tennessee, doing all type of conditioning. We never saw any of those problems. And then so we said, well, let's do a study. We did a big study on safety, and this showed that there was no problems compared to creatine users, non-users. And then we did another study where we found that it caused less cramping and less heat problems, and often associated with anecdotally on the internet. And so we then replicated that with our late friend Mike Greenwood's work, and that then became part of the position stands in 2007, 2017 from the International Society of Sport Nutrition, and they've been accessed over 500,000 times, almost 1 million times collectively. And conclusion was it's safe. And this was the bottom line, is it's safe and the most effective increased strength and performance, and it's been used in clinical populations for a long time. And so we also made comments that if you're going to make public policy about creatine, it should be based on the science, not speculation, not poorly designed studies, and that if government institutions make legislation, it should be based on science, not on hyperbole or misinformation on the internet. In fact, we even went farther and said if you don't allow your athletes to take creatine, you may be putting them at risk for head injury and spinal injury, because the data was pretty clear, in animals at least, that there may be some benefit in reducing the severity of those things. And so the creatine misinformation continues, and we see things like our form mixes better, it's more effective, it absorbs better, doesn't cause any side effects, it's safer than creatine monohydrate, shouldn't be taken by those less than 18. And so all these things are often perpetuated by companies trying to gain market share. And yet our paper in 2022 showed that really the only well-studied form of creatine that's safe, effective, is creatine monohydrate. And although a few others have been shown a little bit of efficacy, none have been shown to be better than creatine monohydrate. And so here's an example, not to pick out a company, but if you follow or on Instagram, you'll see lots of these advertisements, and some of the information is correct, and some of it's like, where are you coming from? And so this form is a hydrochloric acid form. It says it's 7 times more absorption than creatine monohydrate. It doesn't cause any of the side effects that creatine monohydrate does. It doesn't cause water bloating, and you only need to take about 750 milligrams, 0.75 is equal to 5,000 milligrams of creatine. But solubility is not bioavailability, and this has a lot of misinformation, but this is what the public sees. And so if you look at the can, 7 times more absorbent. Clinically studied. Well, creatine monohydrate's been studied a lot, but HCl has only been studied about 5 studies. None of them show superiority over creatine monohydrate. And you only need 750 milligrams. So if you do the calculation, you're paying about $2 a gram for creatine, where you can get creatine monohydrate for 5-10 cents, or even less per gram. But it's not just companies. If you go onto WebMD today, you'll see that it causes all type of side effects. Now, they do say there's benefits, but you might be dehydrated, get stomach upset, muscle cramps. And did anybody know that it could cause bipolar disorder? Apparently, WebMD knows more than we do as the creatine researchers, because if anything, it's been shown to be opposite of that. And so, while scientists understand about creatine, and I think a lot of the athletes understand the importance of creatine, we need to better educate our friends in the healthcare industry. We need to better educate the public about creatine. And so we started the Creatine for Health initiative to educate the public, to translate the information to the public and to the healthcare practitioner who may get questions about creatine from their patients. We also wanted to increase the scholarly productivity and activity, not only in the scientific journals, but get it into the general public through lay articles and information that they can digest, whether it's on social media or in just lay articles. We also wanted to get creatine researchers together to talk about, well, what should we be doing down the line to really advance the field? And these conferences are amazing to do that. I'll never forget Roger Harris at the 2010 or 11 conference in Cambridge reached over and sat next to me and said, "Did you realize all this research was going on cancer?" And no, it's not unless we get groups like this together we find this information out ahead of the publications. And so the Creatine Health Conference developed educational website materials, and we then developed an advisory board where we had some outstanding people, collectively have published over 380 or so publications on creatine, all types of aspects. Then we also have a very outstanding advisory affiliate board, which have collectively published another 550 or so publications. So we've got a lot of people doing a lot of science that know what the impact is on various aspects of health and performance with creatine. And so our first 2022 initiative, we said, let's ask researchers to write papers and summarize the literature on these health aspects. So we did a special issue with Jeff Stout and myself in Nutrients, and we did 27 articles on overviewing the health impacts of creatine, to metabolic basis, to bioavailability, to pregnancy, children and kids and adolescents, exercise and recovery, women's health, older adults, medical rehabilitation, brain health, mitochondrial dysfunction, glucose and diabetes management, heart health, vascular health, immune response health, even in cancer, and then irritable bowel disease and post-viral fatigue, even with COVID. It's like, did you know that creatine did all those things? Well, not even the scientific community knew all that. And so these papers have been cited over almost 1,000 times. If they were a journal, they'd be highly one of the top impact factor journals, just those ones. 680,000 downloads, 3,000 ultrametrics that are being talked about. The book is available. So that's what we did in 2022 with our conference. And that conference was much different than today. It was all by ourselves with a camera. It was very interesting to do this during COVID, but that attracted over 350 viewers, 39 different countries. We then, with DBS, has done conferences in Chile, in Colombia, and in Mexico, specifically on creatine, educating the different parts of Central America and Southern America on creatine. And we're now at the Creatine Conference. We also said, we really need to get the information to the public, so let's put together a website. And so if you go online, you'll see the Creatine for Health website, and this has access to all these articles and books, and as new papers come out, we post them on there. And we even have general lay information for people to follow to help educate the public about. And we did also a number of things on social media. And so we have LinkedIn pages, and we have Facebook pages, and we have Instagram, lots of different social media aspects. And we did podcasts. And every one of our presentations over a few years have now online its own YouTube channel, Creatine for Health YouTube. And so we also did, as creatine researchers, you see this stuff come out, it's like, there's no data to that. It gets very irritating to know how the science is being misinterpreted. So we also formulated a few rapid response. And so there was a couple papers in the Journal of International Society of Sport Nutrition on common myths that were just out, very highly cited and used and referenced. We also had a response to a paper that came out in rats and suggested some cancer effects. And we got together about 30 or 40 of the creatine researchers, said, no, there's no data for that, and there should be no reason why to restrict creatine based on that one study when creatine's been used in a large database of population with no side effects. And then most recently, we got tired of hearing about legislation that said that we're going to restrict creatine to youth. That's the worst thing you can do, is try to take it out of the diet of kids. And so we responded with a position stand that we put out, a press release from the ISSN. A lot of our folks have become famous on podcasts, like Eric Rawson and our Great White North creatine experts, Darren Kandow and Dr. Creatine Forbes, if he's here. And of course ourselves and a few others. There's Dr. Creatine right there. And then we have Abby Smith-Ryan. And so lots of social media. If you go on and put creatine in social media, you'll find lots of informationals. This has been an effort, kind of coinciding effort. Now we're here to our 2025 conference. And the question is, what is the latest on all these main areas of health and disease and management? And the question is it working? Are these efforts just urinating in the proverbial winds? Think about what I said. As in America, we might have a colloquial like that. Is it working? Well, our websites have been hit over 300,000 times. We now have LinkedIn followers and Facebook followers and X followers and Instagram followers, YouTube followers. Our videos that we put out, 5.5 million hits or views. That's pretty good impact. And then if you look at the internet searches, usually over the years, 100,000, 25, 50,000 a month on creatine. What happened after Creatine for Health? Boom. Lots more interest now in Creatine for Health. And this is translated to moving creatine for a sports supplement to a health supplement. And if you look at the trends in sport nutrition, active nutrition is the new sport nutrition, aging. And so there's a lot of interest, even in average individual, taking supplements that were thought to be athletic or sports supplements now for general health and active lifestyles. And so the spike in pre-workouts and performance nutrition has been primarily by moving the sports nutrition market into health nutrition and aging nutrition. And over the last few years, we've seen a doubling in the interest and purchase of creatine as a supplement, and the projection is going to double again by 2031. And so obviously people are hearing that creatine's helpful, And they're seeing the potential benefits, and they're starting to add creatine to supplements that would be typically thought to be something for older individuals. And so we are increasing awareness about the role of creatine in pregnancy, in early childhood nutrition, in adolescents and kids and young athletes, but also active aging in the elderly as a way to improve their health status. So that brings us to today.